Okay, here we go. Let's talk about the ventricles of the brain. Um, the ventricles of the brain are nothing more than water sacs that run through the middle of the brain. And the way they're formed is the brain forms as a plate of tissue called ectoderm during development. We'll learn this later. And then it kind of folds up and over, and so the brain tissue is completely around this empty space, which is full of water. Now that water is actually cerebrospinal fluid, which we'll learn about. And indeed, there are several ventricles. This is actually a model here. If you take all the brain away and just look at the ventricles, that's what this is. These two big ones on the outside are the lateral ventricles that run through the two sides of the brain, through the cerebrum out here on the side. Then they come together. This becomes the third ventricle, and then this back here becomes the fourth ventricle. And then it heads all the way down the spinal cord through that little tube that's in the middle of the spinal cord called the central canal. Remember that? Okay. So we'll talk, and I think it's important to realize that the brain, when it forms and comes up there and folds around, that's a pretty important thing for that to happen. And if that doesn't happen properly, then you get a number of different problems created. The first one you've probably heard of called spina bifida. Spina bifida is when the spine, the vertebrae don't close completely around and back of the spinal cord. And a lot of times it's not very much of a problem, but sometimes it is. Sometimes kids, if the spina bifida is in their back here, they're actually paralyzed from that later down. And then there's others where it doesn't even close in through the skin. It sticks out through the back. Right. Right. Well, they're better. That's right. Yeah. Is the baby born?
Oh yeah, he's like 1.5.
Normal kid?
He has no feeling of one ankle down.
Yeah.
But
that's wonderful. Yeah. The worst stage of it is when the brain doesn't completely seal over at all, and then what the condition is called anencephaly, which means no brain, and basically they have no head either. I think I have some pictures for you, which are kind of unpleasant. So this formation of the brain around the ventricles is very important. We'll talk about it more as we go through this. The third ventricle is this one. It's the ventricle of the diencephalon. Like I mentioned, the diencephalon, remember, is just below the cerebrum. The lateral ventricles communicate with each other and with the third ventricle. And this model here shows that all very nicely with the two lateral ventricles hooking into the sides into the third ventricle, which is running back this way. The fourth ventricle is below that. Fourth ventricle is this one back here in back called the cerebral aqueduct and called the fourth ventricle. And we'll see it on some pictures here in a minute. Yes?
For the communication, it's just cerebrospinal fluid, right? It's not like there's neurons.
That's correct.
So communicate just means
Fluid is flowing
travel.
between them. Yeah. These are all just little collections of water, Jerry. This thing I'm holding. These are all just collections of water molded to illustrate what it looks like. And the way they get numbered, by the way, this is another weird thing. This is called the first ventricle, and this is the second ventricle. Two lateral big ventricles are the first and second. I don't know which one's right, which one's left. I don't think it's decided. And that's why the third ventricle is the next one, and the fourth ventricle is the last one. Okay? That's how that weird numbering system comes from. So here's this picture, which I wish I could see from back here. So these are the lateral ventricles, like I said, out here on the sides, going out through the cerebrum. They communicate here in the middle through the interventricular foramen right here. This is the third ventricle right here, coming on back to the fourth ventricle right here. The connection between the third and the fourth is called the aqueduct, or the cerebral aqueduct. And then it connects on back here at the very back to the central canal, which goes all the way down the spinal cord. The brain itself, let's talk about this for a second. It's a large, delicate mass of neural tissue containing lots of internal passageways and chambers filled with cerebral fluid. Each of the 6 major brain regions has a specific function, and the thing to remember, and probably the thing I want you to remember the most, is that as you go up in your brain, things get more complicated. The spinal cord is really simple. Your spinal cord doesn't think. It doesn't put any information together to come out with some other conclusion. So the only thing that comes out of your spinal cord is a few reflexes, like your knee jerk, and some other reflexes that go on. So just always know that when you're going from the lower parts of the brain, which in the lowest part really is the spinal cord, all the way up to the top, it's gradually getting more complex in thought and so forth. Most all of the stuff that we think of as thinking actually occurs up in the cerebral hemisphere. We have a lot of protections to our brain that help keep things intact for us. Clearly, the bones of the cranium, you remember studying the skull bones? Well, those skull bones are like a box, or they're like a football helmet that protects your head. Well, they're bones to protect your brain. And of course, the brain inside of there is kind of floating around in the cerebrospinal fluid, because there's fluid on the outside of the brain as well as fluid in the middle parts of the brain, too, in the ventricles, like we just talked about. There's also 3 layers called the cranial meninges. We've already learned these in the spinal cord, and you remember the tough mother on the outside is called the dura mater, and then below that is the arachnoid mater, and below that is the pia mater. Okay, well those are coatings on the spinal cord down here, but they're also coatings up here around the brain. There's also another concept down here that I want to explain to you as best I can. It's called the blood-brain barrier. How does that work? Let's just talk. I'm going to digress for a second and talk about the blood-brain barrier. Our brain is the most important organ that we have. If our brain isn't working right, we can't do anything. If our brain is not working, we can't protect ourselves. We can't run away from anything. Anything that wants can eat us, whatever. We need our brain to be functional in any way. So our body has all of these incredible mechanisms to protect our brain. Now, we need to protect our brain not only physically from being shaken or being cut or having a bullet go through it, but we also want to protect our brain from abnormal chemicals. And there's lots of chemicals that float through our body, and I'll just use one as an example. I'll use more than one. But I'll use one, it's pretty common, is our sugar, our blood sugar, okay? Now our blood sugar, if we're normal and we're non-diabetic, our blood sugar usually runs about 100, okay? And indeed, but it goes up and down between meals and after meals, and with a shot of insulin, if you have diabetes, it goes down, and it's kind of up and down. But we need our brain to have the same blood sugar all the time. We need the blood sugar to be 100 all the time inside the brain itself. And so we have this system called the blood-brain barrier that is around the brain. On the outside edges, there are cells that help us maintain it. Astrocytes. that allow certain things to go in and other things not to go in. So even though you may be diabetic, and even though your blood sugar may go up to 300 or 400, you're probably going to still feel pretty good. You're certainly going to be able to think, walk, and do what you need to do. Okay? Because the astrocytes in those glial cells are only going to allow the blood that's going actually into the brain itself to get up, to stay right at 100. They're going to control it. Okay? Yes?
So, when there's cases of people who like lose brain function or whatnot, like that's how they find out they're diabetic or whatnot, is that because the blood-brain barrier has been breached, so their blood sugar is higher in their brain now?
Yeah. Your blood, you start becoming comatose with high blood sugar, usually when your blood sugar gets to about 1,000. And when it gets that high, the blood-brain barrier can't keep it at 100. And so people get goofy and get comatose. And that's how they present. They didn't know they were diabetic until that point. Yes?
How exactly do the astrocytes do that?
That's really magic. Man, it's just really magic. Yeah. They just kind of all get around and they hold hands and they say, listen, we're only going to let a certain amount of blood sugar go through here. That's really how they do it. They form a barrier, a blood-brain barrier.
They just get felt in it.
Yes. I hope you did. All right, now here's another example. People used to get meningitis, and they'd have an infection inside their brain. And we would say, oh, well, meningitis, let's see, it's streptococcus, so we can just give them some streptomycin or some, one of these drugs that were just first being invented in the 1940s. And we can just give them some streptomycin out here in their vein, right? It'll percolate into their brain, and it'll clear up this infection. Wait a minute, not so quick. Because certain drugs can get through the blood-brain barrier, and certain drugs can't. So what we found ourselves doing, and I'm speaking generically as a physician, is that we would try to find drugs that could get through the blood-brain barrier, and some of them could and some of them couldn't. It was totally trial and error. And when we didn't have a drug that would get through the blood-brain barrier, but it was the only antibiotic, for example, that would kill the bacteria that we knew were living in there, we would shoot the drug straight into their brain. Whoa! Yeah, that's what they would do. Because that was the only way to bypass that blood-brain barrier thing. Well, these days we know exactly what can go through the blood-brain barrier, we know exactly what can't, and every drug that we need to get through the blood-brain barrier, we have been able to alter it a little bit chemically so that it can now get through there if we need it to get through there. So the blood-brain barrier is a kind of a mysterious thing, I'm just telling you. And it's kind of it's a chemical barrier so that only the good stuff gets into your brain. Because let's face it, we don't want all the bad stuff to go through there, especially if it could paralyze our brain in some way. Okay? Read about it. The cranial meninges, they have 3 layers. We've already talked about them. They're continuous with the spinal meninges, and they're there to protect the brain from cranial trauma. We have a bag of brains up here, and y'all get, these are not for humans. These are sheep brains. And each table or each pair of you, however many of you want one, can have one. And you'll cut them in half here in lab, and you'll learn all parts, and you'll find that to be very helpful. But you notice that these brains feel like they're kind of rubbery and kind of tough, and so forth. That ain't the way it is, okay? The only reason the brains are tough like that is because they've soaked in this preservative for months. Right when they come out of the head, it's like Jell-O. Your brain, sitting here in the room, all of these brains are just like Jell-O. And that's why when you shake a baby, think of the brain as being like Jell-O in there, but it has little blood vessels running through it. Okay? And think about if you took a piece of Tupperware and filled it up with Jell-O and put the top on it, okay? And then you took that, let it solidify, let it turn into Jell-O, and then took it and shook it, okay? And then took the top off and looked in there, there would be a whole bunch of tears in the Jell-O, right? That's what shaken baby syndrome is. That's what happens with babies when parents shake them. And it's a tragic injury. These kids are usually retarded for life and have all kinds of visual and other problems as well. So, and why am I saying this? When I was a kid, I read this book about Abraham Lincoln. And you guys maybe read books about Abraham Lincoln too. And one of the stories, and I remember reading the last chapter, and the last chapter was about his assassination. And John Wilkes Booth put a gun to the back of his head and blew a big hole in his brain back there. And the doctor was called, and he looked at him and he said, "Oh, he stuck his finger in the hole, and he said, 'This is a mortal wound. He's gonna die.'" And they said, "Well, what should we do with him?" And they said, "Well, let's pick him up and let's take him across the street. There's this boarding house, and let's just let him lay there until he's gone." And that's what they did. And they laid him in a bed, and they only had one double bed in the whole place. And he's a tall man, and they had to lay him on an angle across the bed. Funny the details you remember after all these years, you know. But the thing I remember was that as he continued to lay there through the night, his brain kept seeping out through the hole. And that's the way it is for all of us. Your brain is really like soft Jell-O. And if you make a hole in your head, your brain's going to come drooling out. It's not like what we give you here in lab. Okay? That's really the point I wanted to make, is that what we're giving you here is not reality. Okay? Because it's been soaked. Well, here's another story about that. John F. Kennedy, as you know, was assassinated in 1963, and his body was brought to Bethesda Naval Hospital, where I wasn't there at the time, but that's where I went. Spent 9 years of my life up there in the Navy, learning surgery and medicine and so forth, and teaching. And they took him to the autopsy room there, and they did an autopsy on him, and they didn't do a very good job. The science of forensic pathology was not in existence in 1963. There was one guy in the whole United States who called himself a forensic pathologist. He was a professor over at Johns Hopkins University, which just so happened was only 30 miles away over in Baltimore. But they didn't call him. So these dumbass senior Navy pathologists did this autopsy on him. And at the end of it, they said, well, you know, his head's about half blown away. Let's take his brain and let's preserve it, and we'll study it later, because that's the way you have to do it. When you study the brain, you have to preserve it for like 3 months until it gets stiff, and then you can cut it up and really figure out where the injuries were and so forth. Well, his brother was Robert Kennedy, and his brother just so happened to be the Attorney General of the United States. And there was a whole bunch of photographs taken at the autopsy that you've probably seen since. Well, Robert Kennedy, RFK, did not want those released to the public, and they weren't released until about 10 years ago. They were totally secret. He certainly didn't want his brother's brain showed to the world, being blown apart. And so he went out to Bethesda a day or two later, before they even buried John, and he got the brain. He got everything. He got the clothes. He was the Attorney General of the United States. Come on, he was the #1 law enforcement officer for America. He got it all, and it all disappeared. John F. Kennedy's brain has never been found. We've never had an actual autopsy done on his brain because of that. But it was soaking. The docs put it in stuff, and who knows? It's probably stiff by now, wouldn't you figure? Okay. Crazy, huh? Anybody see where I left my clicker? I hate it. I hate it when that happens. What? Over by the brains, maybe so. Oh, thank you. I appreciate y'all looking after me. Okay, let's talk about dural folds for a minute. Dural folds are where the dura kind of takes a fold down into the brain. And the biggest one is the falx cerebri. And let's just think about that. Here's the top of the skull up here at the top. And then over here we've got this lobe of the cerebrum, and over here we've got this lobe of the cerebrum. So this is brain, and this is brain. And here comes the dura. Here's the dura out here like this. And the dura takes and folds down in through between the two lobes of the brain, and it does like this. It folds back up like that, okay? And this fold of the dura is called the falx cerebri. Falx meaning midline, cleft, kind of down through the middle, and the cerebri. Down here at the bottom end of it, doesn't really all fuse together. These kind of fuse all the way up through here, and form kind of a sheet of dura that kind of keeps the brain from sloshing from side to side because it's this tough supportive stuff. But down at the bottom, it forms a blood vessel. That blood vessel, we're going to learn, is a vein. It's a venous sinus. And it forms another one up here. And this one's called the superior sagittal sinus. And this one's called the inferior sagittal sinus. Sagittal meaning in the midline, right? And so you have two sinuses, one at the top and one at the bottom. And in between is this double layer of dura, which is called the falx cerebri. Okay? So that's one of them. That's the biggest one. And you'll see that on your sheep brains, and you'll see it on our models. Then there's the falx cerebelli, which is the exact same thing, except it extends down between the two lobes of the cerebellum. Okay? So the dura kind of sneaks down in between the two lobes of the cerebellum, remember back in here. And then there's a third one called the tentorium cerebelli. Tentorium probably makes you think tent. Okay? Well, it's a fold of dura that kind of forms a tent, and it forms the division point between the cerebrum above and the cerebellum below. So the tentorium cerebelli is back here in the back and divides the cerebrum above from the cerebellum below. Okay? We're going to learn about cranial blood flow and how the blood flows into the brain and how it flows out of the brain. But it always flows out through these veins, these dural sinus veins. It's an important part of the thing. So here's the three of them again. Falx cerebri, I drew it for you over here. It contains the superior sagittal sinus up here at the top and the inferior sagittal sinus down here at the bottom. The tentorium cerebelli is this tent down at the back of the cerebellum, between the cerebellum and the cerebrum, and it contains the transverse sinus. We'll talk about that as well. The falx cerebelli divides the cerebellar hemispheres. It's also in the midline. Now let me tell you, the falx cerebelli is pretty damn unimpressive. It only extends down in between the lobes of the cerebellum about that far, whereas the falx cerebri up top, you know, pretty significant in size. Just a kind of a close-up picture. You should read through this section in your book about the meninges. But here's the dura mater, the outside layer of the dura mater, called the endosteal layer, which means it's right up against the bone. And then there's the dural sinus with blood flowing between it. Here's the inner layer of the dura mater called the meningeal layer, because it's right up next to the other meninges, the spidery one called the arachnoid mater, illustrated here, and then the pia mater, which is the last little layer, which lays right on the brain itself, and then the cerebral cortex, shown in yellow here below that. Here's kind of if you took all the brain out and just left the dural folds, this is what it would look like. It's a really nice depiction of this. So here's the falx cerebri extending down between the right and left lobes of the cerebrum. The one at the top is called the superior sagittal sinus. The one at the bottom is called the inferior sagittal sinus. Here's this little bitty falx cerebelli back in the back that supposedly divides the two lobes of the cerebellum, but you can see it's pretty pitiful. And the tentorium cerebelli is illustrated right here, and you see it forms a tent between the cerebrum above, the cerebellum below. And you notice that there's a sinus here. This is called the straight sinus, and the blood comes this way, and it comes this way, and the blood in the straight sinus here goes back. Everything all meets up back here at the back of the head, and from the transverse sinus it goes outward, and then it wanders around and comes down, and eventually it's going to turn into the jugular vein. Remember the jugular? No, you haven't had jugular vein yet. Yeah, jugular vein is going to carry the blood back to the heart, down through the neck. And I have a nice animation to show you, and except I'm not really set up to do it, so I'll do that next time. We'll stop right there. It's a nice little cartoon depiction of blood flow through the brain. Okay? All right, so we've gotten a start on things. We'll have a quiz next Tuesday. It'll be over what we've talked about today and what we will talk about on Thursday, just so you know. Yes? Are you going to sneak in chapters 12 and 13 in that quiz? No, I'm not. That's a good question, though. If she's giving you a hard time, you tell her, I think that was a really good question. You're welcome.
Hey, I talked to you last winter term about me. I have to leaving to see my nephew.
Yeah.
And I sent you an email with my date, so I'll be gone on Thursday and Tuesday.
Somebody left their iPhone up here. Remind me, when is it?
I leave early morning Thursday to get back late night on Tuesday.
Oh, okay.
Can I maybe take the quiz in between lecture and lab on Thursday?
Of this week?
Next week. I won't be here. I leave at 5 in the morning.
Yeah. Yeah, sure. Just remind me.
Okay,
Send me an
cool.
email. I don't like to have to keep track of things like that.
Okay, thank you.
Yeah. No, that's for you to keep. Or throw away. Thank you. I'm doing okay.